Evaluation of the composition of the pediatric cancer survivor diet as a need for nutrition. Cancer is a disease whose progression is driven by a series of accumulating genetic and epigenetic changes influenced by hereditary factors and the somatic environment. These changes result in individual cells acquiring a phenotype that provides those cells with a survival advantage over surrounding normal cells.
At the simplest level, cancer or cancer cells are cells that have lost the ability to follow the normal control that the body exerts on all cells. In our body, we have billions and billions of cells, and they have different functions. It's a very complicated process under incredibly phenomenal control. And if something goes wrong and that control is lost, and particular cells escape the normal control mechanisms, and they continue to grow, and they may spread, that's what we call cancer.
As those cells grow and divide, they turn into a mass, or they clump together, and that's what we would call a tumor. And then they can get smart and then spread other places, and that's what we call metastasis.
Cancer can actually occur anywhere in the body because there are cells everywhere in the body. In women, one of the most common cancers, of course, is breast cancer, and in men, prostate cancer. And in both men and women, lung cancer and colon cancer are common cancers.
Applications in nutrition. The American Cancer Society rules nutrition and physical activity guidelines for cancer survivors focus on preventing and resolving nutrient deficiencies, being a person of a healthy body weight, preserving lean body mass, and reduce nutrition-related side effects as well as increase quality of life for cancer survivors. These guidelines recommend that cancer survivors get at least 150 minutes of moderate to vigorous activity per week. Consume at least 5 servings of fruits and vegetables each day, and don't smoke.
Encouraging foods that are high in calories and protein, such as milkshakes, meats, dairy products, peanut butter, mac and cheese, and pizza, will help maintain an appropriate weight. A traditionally healthy diet won't apply to a patient going through treatment. The most important thing is getting as many calories as possible. The dietitian can also provide suggestions during times of experiencing poor appetite or taste changes as a result of therapy. Nutrition can be tricky, and sometimes certain medicines or other medical interventions are needed to help calorie intake stay consistently high. No one should feel like they have failed if interventions are needed. Almost all patients need help, and it's only temporary. There are many options available to fit everyone's unique needs. These options include a high-calorie, high-protein diet developed by the dietitian. This includes high-calorie drinks and foods. Appetite stimulants. This is a medicine that works to help the patient feel hungry. Feeding tubes. This includes both the G-tube and NG tube. Or IV nutrition through your central line. There may be apprehension about these interventions, but they are often necessary to help maintain good health, promote normal growth and development, and reduce complications. Both patients and parents are oftentimes worried about these interventions. It's important to remember that interventions help to optimize nutrition. They do not define who you are.
Pros and cons. Pros. Eating the right kinds of foods before, during, and after treatment can help a child feel better and stay stronger. Diet is an important factor in the appearance of the progression of cancer. Cons. Both cancer and its treatments may affect a child's appetite, tolerance to foods, and their body's ability to use nutrients.
Treatment is more effective on a healthy body. Nutrition decreases the risk of infection. Good nutrition helps patients feel better and heal faster, and can even lessen side effects. At Cincinnati Children's, every patient gets assigned a dietitian. The dietitian is a specialist who manages nutritional needs during treatment and can answer any questions you may have. Throughout the different stages of treatment, appetite and taste preferences may change dramatically. Patients can have loss of appetite due to nausea and vomiting. Some foods may taste differently than they did in the past, while other foods may all start to taste the same or lose their taste entirely. Patients may also begin to have specific cravings.
Issue of light in Ecuador. Pediatric cancer has an annual incidence of 13 to 15 cases per 100,000 inhabitants between 0 and 19 years of age, but only represents 0.%. In Ecuador, in the city of Quito, for the period from 2006 to 2010, there were a total of 490 cancer cases in individuals under 19 years of age.
Well, good nutrition is particularly important for cancer patients because we want them to go through treatment successfully, to be able to complete the treatment, and studies show that if a patient continues to eat well, they're much more likely to stay strong, it'll reduce fatigue, they can complete the treatment, stay out of the hospital, and just feel stronger, feel better. When a person doesn't feel like eating, often they will drink. They're willing to drink milkshakes or nutrition supplemental drinks. Instant breakfast is a good option. I always recommend mixing it with whole milk just to increase the calories when their intake is really low. People often will make their own smoothies. You can buy protein powder at just the regular grocery store. Ice cream, I tell people to look for the highest calorie ice cream that they can find. Heavy whipping cream is one of my go-to ingredients to add to milkshake because it's 400 calories a half cup. And you can put it in anything to help increase the calories. And often people need about 2,000 calories a day, 1,800 to 2,200 in that range. So anything that's high in calories can really help them maximize their nutritional status.
Conclusion. It is important to follow complementary dietary therapies to pharmacological treatment in patients with pediatric cancer, in which they are adapted to the needs of each person, in this way that the results of the treatment are positive.
The three goals are eating adequate calories to prevent unplanned weight loss, increase protein, and increase fluids. Adequate calories is important because you need energy for tissue healing and repair. So it's a good idea to eat intentionally during treatment. That means sometimes you may have to eat according to the clock instead of according to hunger cues. You'll be weighed about once a week when you come to clinic or infusion, and most people's weight goes up and down a little bit, but what we want to do is prevent deep dives or increase in weight. The second goal is increased protein. Studies have shown that those going through cancer treatment have a higher need for protein. Protein comes from your animal sources, skinless poultry, fish, limiting red meat, but using it not more than 18 ounces per week, not forgetting about nuts and seeds and legumes, as well as dairy and plant proteins as soy and soy yogurts. To determine how much protein you need, it's about 0.5 gram of protein per pound of body weight. So for instance, a 150-pound person would need at least 75 grams of protein a day, and a 120-pound person, 60 grams. We weigh ourselves in pounds and you measure protein in grams. And to make sure that you get adequate protein, a tip is every time you have a meal or a snack, make sure one of these protein foods is part of that meal or snack. The third nutrition goal is increased fluids. You want to aim for 8 to 10 cups of fluid each day. Fluids can be anything that melts at room temperature. Your go-to will be water, but it could also include seltzer water, 100% fruit juices, broth-based soups, smoothies, and decaffeinated teas. We can't count coffee and tea as a hydrating fluid because they dehydrate you, but you certainly can have some of those as well. Keeping in mind these three nutrition goals of adequate calories to prevent unplanned weight loss, increased protein, increased fluids, will help you to eat your best and feel your best during treatment for cancer.
Thank you for your attention.